everyone, my name is Sofia and today we are going to talk about back pain and cervical pain with Dr. Dipesh Batra, super specialist and MCH neurospine specialist. Welcome.
Good morning.
Could you please tell us what are the symptoms of a cervical pain?
So whenever we say cervical pain, so it means we are talking about our upper 7 vertebrae, that is neck. So cervical is a region which is equal to neck. So it is one of the areas of spine which is most mobile, that we can do so many movements with our neck. So whenever there is pain in the neck, or the pain radiating to the shoulders, or the pain which is initially a neck pain and which is radiating to your arms like this, or in the arms or the forearms like this, or which is neck pain which is radiating till shoulders. So or sometimes the patient is feeling dizziness with that pain, or the patient is feeling a kind of vertigo or loss of balance or imbalance. So all these vignette, we label it as a cervical.
And what kind of risk factors can contribute to back pain?
It's a very good question actually. In today's world, as everybody is busy on social media, right. So whenever a patient who is very busy on social media, their laptops, their computers and their mobiles, so I called it as social cervical, because like we are reading this paper like this, so my neck is flexed, or we are just doing messaging like this, my neck is again flexed. So any work which is causing prolonged flexion of your neck, that causes your muscles to lose their ability to stretch, and your muscles are contracted permanently. So this problem, initially this problem was occurring in the ages of 30, 40s, but due to overuse of mobiles, your social media, this problem is occurring. I can usually see children age from like 12 to 16, the adolescent, in my OPD. So this problem is very common because of competition pressure, the education pressure and peer pressure.
So what should I do when my back hurts?
See, if you are talking about only cervical, so then I can suggest you should do cervical strengthening exercises. You should take good diet. You should reduce your weight. You should modify your habits, and like your pillow should be that small so that your neck should keep in extension. And you can apply cervical collar if your problem is severe, and if there is radiating pain to your arms, yes, then that is the time that you need to take medicines.
And why should I worry about my back pain?
Yes, it's again a very good question. And one question that I always, has a very strong point of view, why you should worry. Everybody in this world is suffering from back pain, but we should be worried because any back pain which is more than 3 months long is called as special back pain. Otherwise, a common back pain, there are attacks of waxing and waning attacks which comes for 3 to 5 days, and they just go off by medication or just by exercises or by relaxing and stretching your body. Any back pain which is more than 6 weeks, we called it as a special back pain. So that back pain need to be investigated, because the back, if your back is not right, you cannot walk properly, you cannot sit properly, you cannot work properly. So that is the worrying thing. Other thing is pain. The pain will produce such kind of hormones in your body that you will always feel stressed and you will always feel dizzy.
What are the possible diagnoses of back pain?
See, as I told you earlier, if the pain is in your neck region, we call it as cervical. When it is lower back pain, it is usually due to a disc disease, because there are 31 vertebrae in our spine, right from neck to our lower region, and there are 25 intervertebral discs. So whenever there is increase in disc pressure, the disc gets punctured and it injures your nerve root or cord, which produces the whole scenario of the back pain in the lower back. And the pain is getting that is called as radicular pain if it is going to your leg, and it can be lower back pain. The pain may be in the center, or maybe in the one, or maybe in the both legs. You are feeling numbness, or you are feeling, so many of symptoms like aching back pain, or sometimes it is cruciating back pain. So these kind of symptoms you may have.
And why does back pain can become chronic?
Yes, it can become chronic because once there is a back pain or there is a disc problem, your posture tend to be incorrect. With incorrect posture, you are walking, you are sitting, you are dancing, you are jumping. So you are permanently irritating that one point, your facet joint, your ligamentum flavum, or your nerve root. So that can damage that part of your back, and maybe like after 20 years or 30 years, that part may need surgical correction.
Can you tell us some non-surgical treatments?
As I told you earlier, that decrease in weight, like to quit your sedentary lifestyle, quit alcohol, quit smoking. I have seen so many patients of mine who have decreased their 15% of their weight in over the period of 3 to 6 months, and they are just free of back pain. In the non-surgical treatment, we give nerve blocks that are CT guided nerve blocks. Very few of the neurosurgeons are giving, and other are the treatments. Then there are nutritional supplements like glucosamine, chondroitin 4-sulfate, glycosaminoglycans, and there are so many antioxidants. So high protein diet, rich calcium, rich vitamin D diet, which can help to cure your back pain. So all these are herbal medications. They are just nutraceuticals which you can take in your diet daily. It can be part of your routine. So one can cure his or her back pain by doing all these spine strengthening exercises, getting early in the morning, going for a walk, going to gym, but under a doctor's supervision.
And what are the herbal remedies you could suggest?
As I already told you, these are glycosaminoglycans, chondroitin 4-sulfate, glucosamine. These all are the calcium, the vitamin D, which can help to regenerate and rejuvenate your vertebrae, your intervertebral discs, and the myelin around your nerves. So one should be very cautious and curious whenever you are a patient of a back pain. So you should follow all the guidelines, all the restrictions, all the precautions. And one should exercise daily 10 to 15 minutes. You can do cervical strengthening exercises, you can do lumbar strengthening exercises, and you should choose a proper and good diet.
And what can be the duration of this treatment?
See, it all depends what kind of back pain you have. If I'm talking about just, you can say this herbal treatments, they can be taken lifelong because they don't have any side effects and they are free of any side effects, and one can use it as a part of their daily routine, their food, like we eat our food, so we can take these kind of supplements with our food.
Thank you, doctor, for visiting us today and providing so much information about the back pain. We know how much herbal treatments can help us. In case if you would like to receive this treatment, you can order it from our website or contact us at the below mentioned number.